Joining me now to discuss whether this plan is the best one for the American people and best possible, one of its architects, Congressman Kevin Brady. He is the chairman of the powerful House Ways and Means Committee. And, Mr. Chairman, it is great to have you with us.
Lou, it's always good to visit a fellow Texan. Thank you.
Amen, brother. These are tough times, however, for even Texans, because we're looking at a GOP, irrespective of what anyone is claiming here. Right now, the GOP conservatives are very concerned about a number of issues, amongst them tax credits. They're concerned about taxes on the Cadillac plan. They are concerned about Medicaid extension, its cost, and the reasons and why fors that the Republican leadership decided to preserve it. So let's start with those three principal objections and critiques, if I may, from the conservatives and your response.
Yeah, well, first, let me just this is not conservative opposition. These are conservative colleagues. They have great ideas. In fact, we're working with them. I've been working all day long, as we have almost every day, trying to make sure we get as much as we can in this repeal and replace, because we have two big principles together. Not just get rid of all the taxes, all the subsidies, all the mandates, the funding for Planned Parenthood, all that's going. It's Obamacare gone. The question is, can we restore state control of health care? Can we restore the free market? That's where we're having great discussions about how we do that. And I'm just telling you, at the end of the day here, Lou, we're going to come together to back the president on this and get it done. Look, we've fought for 7 years together for this day. It's not a tough time. This is an exciting time.
And it's interesting to hear, again, Speaker Ryan talk about better way last night. Today, lecturing, not seeking the input and the views of fellow conservatives, as you styled them, and I think correctly, but lecturing them as this is the best possible solution, which suggests in regular order and with public hearings. Your own speaker would not, he would be shocked, I guess, to hear some better ideas.
No, I will tell you, I see it exactly opposite. Look,
right.
What Speaker Ryan was trying to do is explain the environment we're in and how we have to try to stuff, 20 pounds of reforms and more choice and state control into what the Senate rules will allow us. What he was pointing out is, here are our challenges, but I know this. Every meeting, every phone call, every discussion, every sit-down I'm having with our conservative friends, they've already sat down with the speaker. So, look, I don't buy this. He's not listening. In fact, just the opposite. He and I and others have been working through the weekends and nights to try to bring as many of these ideas into this plan as possible. And we have more work to do. And by the way, this is historic. Repealing an entitlement, once it's embedded, and replacing it has happened one time in history. Look, you can't do it all in one bill, but we want to do as much as we can in this first bill.
I understand. And with three phases, two that go beyond the one piece of legislation, it is historic. But on the other hand, the idea that entitlements are being curtailed, when, as you well know, many of the conservatives, senators, particularly Senator Rand Paul, Senator Mike Lee, are concerned that those tax credits are simply subsidies under another name.
Well,
can you reassure them?
Yes, I do. One, I know where they're coming from, and we're always cautious about making sure there's equal treatment in the tax code. So the biggest health care entitlement after Medicare and Medicaid is the one that you have. You and everyone else, including me, who work at a big business. The largest tax break in the tax code is this health care break. So the question is, why can't small business people get the same treatment? Why can't an entrepreneur or the mom and pop deli that's the bottom of your building that doesn't get any help, why can't they get equal treatment? That's what we're providing, because the truth of the matter is they work just as hard. They're as critical for the economy. They're working hard and playing by the rules. So that's what we're doing.
Well, and small business people, as you say, certainly are as deserving, are more deserving of that treatment under the tax code without question.
And the other thing, too, I think I want to make sure, Lou, you know as well, look, we know It's going to take states a while to take back control of health care, design it for their families and communities, approve all these new plans away from Obamacare. That's why we want to act now. Secondly, restoring the free market, actually giving people choice over their plan, not the one Washington wants for them. That will take some time. So the reason we're moving now is to make sure our states and frankly, our individuals have plenty of time to get this in place. You got to get it right.
Got to get it right, and that begs the question as to why your committees would even move the legislation forward without getting an assessment of cost that you could, showing that respect for the taxpayer that President Trump insists be the core value of federal spending.
So, Lou, I think that's a fair question. So we know that because of the Senate rules that the House is working hard to comply with, that this has to balance, not just balance in over 10 years, it has to balance for over 20 years. So we know for us to bring it to the floor, it has to do that, and it will. It's not the numbers to balance it that we're waiting for. It's really the who gets covered by state control, how much are insurance premiums reduced. So those are the types of information we're waiting. And I have to tell you, when we do get CBO score, it will only be a piece of the puzzle because we've got more work to do to restore the free market after this bill.
There is something there's something that resonates when a representative of government talks about restoring the free market. I understand what you mean. I understand what you're saying.
Yeah, yes, you do. It's hard trying to take that huge bureaucracy, and pull it up by the roots and actually restore choice in products. It is a fight, and we're going to have to be relentless to get this done.
Relentless, and at the same time open-minded and generously accepting of a lot of views that have not represented quite yet in the legislation. Would you agree?
Yeah. Look, we are always improving this. There are great ideas out there, and I'll just tell you this from Ways and Means perspective, from Speaker Ryan as well. We're going to accommodate every great idea we can in this.
Who's the arbiter on what is a great idea?
So when we reach consensus, House Republicans are. We're the ones driving this in a big way. We just always got to deal with those Senate rules, and we're going to stuff as much conservative free market reforms as we can in this.
Well, you know what might be a byproduct? The Senate rules, arcane as they are, as you suggested, perhaps there will be immense support for reform and good sense in the Senate. But that might be too much to ask for.
Feel free to drag those senators on this show and ask them that question. I'd love to hear the answer.